Hi, and welcome. I'm Kira Sorrells, the founder and executive director of NICU Parent Network, and I'm here for our Friday feature. I'm very excited because we're actually launching a new component of this discussion series. We started this back in the spring of this year, where we were highlighting our members. In fact, I think Betsy, who I have with me again today, might have been our very first, if not our, one of our first Friday features where we were able to highlight our members. We also started the Friday feature, Let's Talk About Race, which occurs the first Friday of every month. And now we are adding the Friday feature Health Highlight. And this is where we're going to be able to have a discussion to draw greater awareness to a specific disease area or medical condition that we commonly see in the NICU population. We hope to be able to share valuable education and resources and also highlight some of the amazing work that's being done in these disease areas, both by professionals such as researchers and scientists and medical professionals, but also the NICU parent leaders that are very integral to this work. Most importantly, we want to empower you, the NICU support organization leaders out there, those NICU parent professionals, to never stop learning. So today, I am very pleased to have Betsy Pilon here with us. She is the founder and executive director of Hope for HIE, and we're going to be talking about neonatal seizures. Betsy, thank you so much for being here today.
Thank you so much for having me. And I'm really looking forward to this discussion for, a few different reasons. November is Epilepsy Awareness Month. So I think, talking about neonatal seizures is really important. And, we're going to get into it a little bit more about how we've been able to work on some different research projects. And there's also other, NICU support. Okay. There's other NICU support organizations in some of those projects as well. So I think it's there's a lot of wonderful examples of collaboration in different ways through the conversation that we'll have today.
Yeah, I remember when I first, kind of got into maternal infant health, I really didn't think of parents as having a place in research. But, obviously, I mean, we really are the key informants and the key stakeholders because it's our kiddos, right? They can't speak for themselves. So it's on us as parents and parent leaders to be at those tables. So I'm really excited to hear about all the work that you're doing and that you know about. So, but let's start off just really quickly. For anybody who has not met you yet or has not come across Hope for HIE, could you share just briefly your NICU story, and how this led to an interest in advocacy work and research in neonatal seizures?
Absolutely. So, excuse me. Mm-hmm. In 2012, my first child was born, and he stopped moving when I was 37 weeks pregnant. So it was so sorry. Very uncertain. And excuse me. And everything, we expected, like, after you get through a certain point in your pregnancy, you're fine. Like, if a child has to go to the NICU, it's normally for just like a couple days or observation. And we unfortunately did not have that experience. So Max was born by emergency C-section. He was very, very sick. We didn't know how sick a full-term baby could be. He was transferred down to the level 4 NICU. Okay, sorry, this is flickering, right?
Oh no. So, I don't see a flicker.
Oh, good. Oh, maybe it's just my screen then. Okay.
Maybe. I don't see it. I don't know if anybody watching can see it or not, but I don't see it.
This is like post-Halloween. Like,
I know.
Yeah. But excuse me. And so he received the current therapeutic, which is hypothermia. So it's brain cooling, which happens for 72 hours. And excuse me. And babies are typically very sick with HIE when they're born. And so you kind of go through this course for us. I'm so sorry. Of course,
It is okay.
I was not coughing at all before we started.
No. We had a good 10-minute chat before going live, and you were fine. It's okay. It's real life.
So, yes. And so for us, the NICU was, obviously, like for anyone, it can be very overwhelming. Max was in the ultra critical pod. He was, the only full-term baby. And he was very, very sick. So we just, were very at a loss of, a loss for information, for education. We received excellent clinical care. And he spent about 3 weeks in the NICU. And once he was discharged, they said, "Do you have any questions?" And I said, "Yes. Can you connect me to other families that have experienced this? Is there educational information I can connect into?" And they said, "No, we don't really have anything." And they handed me a brochure for early intervention services and for our state Medicaid supplemental program. Said someone will be calling you. And so we just felt like there was you experienced this huge gap. And they also told us to when you go home, don't go Google. And well, of course, I didn't really listen to that. So thankfully, went home and found 3 families that were connecting and blogging about their experience. They referred me to Hope for HIE, the Facebook group, which when I joined, there were about 200 to 300 families from all around the world. And that became my lifeline. And everyone had a similar experience of feeling that gap in support and educational information, and that there was a lot of misinformation that people came across online about HIE, or it was just really overwhelming medical journals. So, clearly there was a need to start something with the initial goal, honestly, of just getting the word out that there was a community of support and peer support. And so, some of us got together and created, with the blessing of the founders of the Facebook group, created Hope for HIE, the foundation. And like I said, the first couple of years were really just about building, a web presence and basic educational information and, kind of why it's beneficial to connect into peer support. And then we've been able to grow, get involved in research, really grow in different ways as a patient advocacy organization. Support is still at the heart of who we are. Absolutely. But certainly, there's just more that we're able to do now in this part of our organizational journey. So, and, one thing that we've always been so grateful for are collaborations with different organizations. And I feel very fortunate to have been connected to people like yourself and other organizations who are further down the path to kind of help us and mentor us in how we grow. And so now we are now connecting over 8,000 families worldwide. HIE itself is about 2 to 3 per 1,000 live births it happens in. So it's rare, but not rare. So our families kind of get stuck in between this world of, 1 in 10 babies are born premature. Obviously, it's NICU Prematurity Month, Prematurity Awareness Month in November. And there are some babies that are premature and born with HIE. So, but it's just less common. So there's been this kind of gap in understanding. And so we've worked really hard to continue to bring awareness and education forward.
Well, until I met you and you became an NPN member, I had never heard of HIE. So I've learned a lot from you just in the last couple of years. Now, I do want to, reiterate, of course, that neither Betsy or I are medical professionals. We are NICU parent professionals. And so anything that we're going to be sharing is not medical advice, but it is information and education that, that just any parent can understand. And that's what we're doing today. So What is a neonatal seizure, Betsy?
Yes. So it's probably can be strange to think that babies can have seizures. I
Mhm.
definitely didn't think about that in our, any realm of thinking about pregnancy or being a parent or anything like that.
Right.
So a neonatal seizure is just a type of electrical misfire in the brain.
Mhm.
And they present in different ways in the NICU. Again, and some babies are more prone to them than others. So HIE is the top cause of neonatal seizures, but there's other like any sort of brain potential impact. So IVH can cause neonatal seizures, or something genetic could also cause, and that's a lot of kids will now get screened in the NICU.
Mm.
Um, for different genetic issues as well that might have a greater likelihood of being at risk for seizures.
Mhm.
And so yeah, basically babies that develop neonatal seizures, the goal is to get them under control. So if it's through HIE, typically it's within the first 24 to 48 hours of birth.
Okay.
um, and there's frontline treatments that are available, like anti-epilepsy medications. The frontline one is called phenobarbital, and that's like tried and true for many, many, many years. And we'll get into the practice change that's happened over the past 10 years with that as well.
Yeah.
But essentially it's like an electrical storm in a baby's brain. And the causes vary.
Yeah. And so with your son, do you remember I'm sure you do, the first time you saw him have a seizure?
So actually, Max, when he was born, was given a dosage of the phenobarb, and
Uh-huh.
so he did not experience any neonatal seizures. But he
Okay.
was, and they don't know if that was because he could have been like, since he stopped moving at 37 weeks,
Mhm.
he could have been seizing in utero, and we didn't know.
Okay.
Um, or he could have, or the phenobarb is what controlled it because they gave him such a high dosage at birth to try to prevent them.
Okay.
But he did end up developing epilepsy at age 8. So I have seen him have a seizure, just not in the neonatal
Not
period.
the neonatal part. Okay, that's interesting. So in regards to the neonatal seizures, when we talk about who is most at risk, you
Mhm.
started to talk about this a little bit, but it's pretty much any baby who has had some sort of brain injury
Something.
or
Yes.
issue or brain something.
Yes.
Okay. And
Or brain malformation. I mean,
okay,
like there's kids that have neonatal strokes or in
right.
utero strokes. And
Yeah.
sometimes when they're born, the first symptom of finding out that something's not right, like their APGAR scores might be wonderful. And then as they're acclimating to the outside world within that first 24 to 48 hours, that's when they might start seizing. And the protocol is really the same for
Yeah.
any kid. It's to give them that frontline medication and try to get that control, and then move forward.
Okay. And so they have a neonatal seizure. Does that mean that they are going to develop epilepsy, or are they like kind of two totally different things?
Yeah, not necessarily. It does increase the risk
Okay.
of developing epilepsy, but also, something that, and we'll get into the neonatal seizure registry stuff later, but one of the top researchers in the US, Dr. Renee Shellhouse, and she is on our medical advisory board, and she's an expert in neonatal seizures. And she reminded me when Max developed epilepsy that epilepsy is common in the population too. So it's 1 in 26. I mean, certainly there's risk factors like HIE or other things that can increase the risk.
Right.
But yeah, epilepsy unfortunately is a common diagnosis just in the general population as well.
Okay. And so there isn't necessarily a cure.
No.
Is that right? Yeah.
Sadly, no, but there is a lot of research going into epilepsy research, and a lot of funding, a lot of different people working really, really hard at understanding it.
Yeah.
For as far as neonatal seizures, like if you're able to decrease the incidence of HIE or neonatal stroke or other things, and you can decrease, like it's the cascade of things that can be decreased as well.
Right. So do you think there's anything that's kind of most misunderstood about seizures?
I'm sure there's a lot. I mean, it's a lot to try to understand. I think, I think what's difficult is there's many different types of seizures. So you have, a lot of kids that experience neonatal seizures then can also have a risk factor for infantile spasms, which is a really aggressive type of epilepsy that the onset is typically between 4 and 8 months. And so learning the signs of that is really important as well. Infantile Spasms Awareness Week is the first week in December. And so those kids that are, and it's definitely more kids that have like a NICU experience, and again, have that, neurological impact, are going to have a higher risk factor for developing IS. And it's really important to know what those signs are to get the diagnosis quickly and start frontline treatment.
Yeah. And so let's talk about the research now, and how Hope for HIE is engaging at this level.
Absolutely. So in 2019, we were approached by the Neonatal Seizure Registry group, and that has been a co-funded multi-center study between PCORI, which is the Patient-Centered Outcome Research Institute through NIH, I believe the Pediatric Epilepsy Research Foundation, and there's one other funding entity that I'm probably leaving out. But basically, this group came together several years ago, before 2019 as well, with this collaborative model of looking at getting baselines with neonatal seizures and what work can be done to improve care and improve outcomes, communication, and what's most important to the patient population. So, and of course, as we talked, like we're the ones that are kind of speaking on behalf of that, like as parents. So, so when I joined, there were also 2 other organizations that were a part of the parent panel. So there's parent organizational partners, and then there's actual parents from each center that participates. So we're one of 3 of the organizations. The other is Hand to Hold. So I work with, that wonderful collaboration with them, as well as Casey's Circle, which is in Texas. So, and they, really support a lot of families with medical complexity. And Casey was an HIE kiddo. And her mom started Casey's Circle to, support families. So there was a lot of, collaboration with that. And then again, each of the centers has had at least one parent partner participate in, and this is in a monthly call. We as a group set and discuss like outcome measures, what's most important to us as, parents and families and children. They've done some long-term now. It's been funded and researched for several years now. So some of the key takeaways have been practice changing and, quality of life improving. And, a couple of the big things that, that the parent side has influenced is looking at parent well-being and mental health and, from the impact. So it's very aligned with, all the other family-centered care work and, things like that.
Absolutely.
And, again, I think as we all come together in these different areas, that group lift just makes, the cascade of that improvement even more accelerated. So it's been really an incredible experience to participate in this group. One of the, I alluded to it before, but one of the key takeaways from the science side is, and, a lot of the concerns from families, phenobarbital is a very hard-hitting medication. It does a wonderful job, again, at like taking care of these acute seizures. But it is very, it makes kids really sleepy. And so you don't know, like, is their development impacted, or are they, are there long-term impacts of keeping babies on this a long time? The standard of care when Max was born, was to look at weaning at 3 months or 6 months, or even sometimes there were kids at that point that were on it for a year.
Mhm.
And so they were, one of the concerns from parents was, is this impacting development? Is there, you don't want unless you have to, you don't want your child on medications,
Right, right, absolutely.
And so they found out and studied and now have a protocol that has come out of that to change that standard of care, where
Mhm.
they have the data to show that it actually is safe for many children to be weaned off of phenobarb before they're discharged.
Oh,
So
okay.
that for, you know, reading thousands of stories in our community of families who join in and, are having this like anxiety around this particular, around neonatal seizures and around the management,
Yeah.
moving forward, it's a huge quality of life thing for everyone. Giving
Mhm,
babies medications is really tough sometimes.
mhm,
Normally it's orally given, unless a child is like tube fed, and then it can go down there.
mhm.
Um, but it's very concerning for parents. So
Yeah.
that's been a really positive thing. They've also developed through the research, having a better understanding of what projecting how, like, who would be at highest risk for developing infantile spasms. So now that information allows the NICU clinicians to better educate families who are at risk. And so they know a little bit more what to be on the lookout for, how to, if they have a concerning movement, how to get in with their medical team and get it evaluated. And that education, is really, really critically important.
Absolutely. I mean, it's empowering
Yeah.
when you're educated about especially what's happening with your kid, that they can't tell you what's happening with them, and it really does have to do so much with the parent and being able to recognize and understand. So, can you tell me, because you alluded to this as well, the impact on the parent well-being? And I know this was not on my list of questions for you, but how does epilepsy or neonatal seizures, how does that impact a parent?
Well, I think seizures are scary, and they are the unknown, is extremely scary.
Mm,
There are very real consequences from unmanaged seizures. There's, again, these different seizure types that are more aggressive than others.
mhm.
And witnessing a seizure is very hard on anyone watching it, let alone someone experiencing it. And especially when you think of a baby or a child.
Yeah.
And so, that has a huge toll. And I will say, like, now that I am living that life of being a parent to a child with epilepsy who has
Mhm.
nocturnal seizures, like, sleep is at a premium nowadays because, you just like, the fear is that something's going to happen.
Mhm.
Um, and that, you're going to miss something. And if your child needs an intervention, like overnight, and you miss it, like, could it be something catastrophic that happens to your child?
Right.
So I think, that is
Very
the,
intense.
yeah,
Mhm. Yeah.
like, living with that is really tough. So,
Yeah, really. It really is. And I would just think that, seeing that seizure for the first time, um, must be terrifying.
well, and especially for, people with babies, like, babies do weird things anyway. So, it's like, and especially if you've gone through neonatal seizures and then, they got control in the NICU in your
Right,
home,
right.
and like, especially clonus, like, is normal in all babies, but then, with babies with more immature nervous systems that were premature or had, experienced HIE,
Mhm.
or something like that, it's more common, and like, it can seem like it might be a seizure. So trying to figure out what might be
What
a
is
seizure,
it?
what might not, that is anxiety provoking.
Yeah.
Absolutely.
Oh, for
So,
sure. So, what resources are available for parents that you provide through your organization, or that are available elsewhere as well?
yeah, so I would say there's just a ton of the website for the neonatal seizure registry. It's hosted at I think neonatal seizure registry.ucsf.edu.
Okay.
And it has comprehensive sections for educational materials for clinicians and parents.
Mhm.
You can also follow along for all the latest published papers of the research that comes out of this group. And then again, like support organizations, always going to plug that, whether it's, HI, for the HIE community, obviously we're always helping families kind of adjust to that first year, no matter what they're facing, or any other, NICU support organization, or epilepsy resources as well. So, there's a lot of things that can be done to empower parents, and feel, because I think people feel powerless, like, especially
Sure.
in those moments.
Right.
But the Epilepsy Foundation has free seizure first aid training. And so that's something that we encourage all of our families to get. We encourage them to have their family members, extended family members, grandparents, and teachers and everything. If their children like has an ongoing epilepsy or is at risk for it, making sure that, they're having those conversations with their, daycare or preschool or anything like that. Because especially for HIE, we do see kids like Max who have no seizures until, years down the road, which takes people obviously off guard. And you always hope you're not going to be one of those people and it's not your story.
Right.
But being aware of what to do is really, really important. And having that training is just one way that, again, that you can, empower yourself and empower your family, should something happen, to know what to do and feel more confident in that moment.
Absolutely. And so you mentioned too, obviously this month is Prematurity Awareness Month. It's also Epilepsy Awareness Month, which is why we chose this topic for this month, for our first health highlight. So how does Hope for HIE recognize that? How can other people recognize and support? What can we do?
Yeah. So, we are sharing throughout the month, educational information about epilepsy. And again, for our community, we really focus on the time points of that patient journey, of educating on neonatal seizures, educating on, epilepsy that develops outside of the neonatal period, and what to do, what to ask your physician, how to, where there's resources for developing a seizure action plan if you need one. There's so many amazing resources out there. There's, again, I talked about infantile spasms, but there's also other rare epilepsies. And so we're a part of the Rare Epilepsy Network. And there's, I think now like 75 organizations in that group.
Right.
And there's just a ton of really great educational content that they generate as well. And, again, just like, I think anyone should, I think it's really helpful for Infantile Spasms Awareness Week to be able to, which is the first week in December, to share that out, even if your child doesn't have that, or any of the organizations, like if that's not necessarily a focus, sharing out those educational, tools, can help save these kids from, having, unfortunately, like if diagnosis is later, sometimes it's harder to control. So, and that's again between that 4-month and 8-month period. So I think it's, really helpful for any of the NICU support organizations to share out about that as well. And there's some, again, amazing content that's created with videos and, social squares, educational content. Infantilespasms.org is a great resource. There's just a ton of stuff. And, again, anytime it can feel very isolating. So if someone is going through that and is getting diagnosed, again, being able to know that there's support for that, peer support, there's, different organizations to tap into and coordinate, whether it's a local epilepsy chapter, foundation chapter, or a support organization in another way.
Yeah, absolutely. Well, this has been a really great conversation. Thank you so much. I certainly, some of the takeaways for me are, that education is empowering for families, that there is support available, and that parents have a voice in research. And I think that those are really valid and very important points. And Christy from our great friend at National Perinatal Association says, "Hi, Betsy. I would love to connect with you. The National Perinatal Association's 2023 conference, No One Left Behind, How Perinatology Can Be a Leader in Equitable Care for Public Health, from public health to rare diseases." So I think you probably have a speaking opportunity there. If I was going to make a wild guess, but it certainly is. I just appreciate you sharing so much knowledge and that really has grown out of your personal experience. It's really important work that you're doing. Did we miss anything? Is there anything that you wanted to make sure to mention that we didn't? And I will. I've been kind of jotting down some of the different resources that you mentioned, so I'll make sure to put those in the comments, links to those as well.
Wonderful. Yeah, I think just, about the research side of things, just not doubting, like, especially NICU parent leaders, like, you have an opportunity, and especially how research, like, it is now becoming the standard model to
Mhm.
make sure, like, especially regulatory bodies like the FDA and things like that will not look at some of these developments unless the population that they serve is, noted and worked with.
Right.
So that is actually, I mean, super empowering. And we know that, as you know, as someone that has built this incredible organization to connect people, the best ideas come from that collaboration and multidisciplinary partnership.
Yes, absolutely. That is one thing I know in Europe, it's a requirement for any
Mhm.
clinical study that they have parent organization representation from day one. I mean, it's law in Europe, and
Yeah.
I just hope that we get to that point at some point here in the US.
I
Um,
think we're moving there. I
yeah,
think,
yep.
yeah, it's getting better.
We're inching. We're inching.
Yeah.
Well, thank you so much, Betsy. I appreciate your time, and again, I always learn something new every time I talk to you.
Well, thank you so much for, again, what NICU Parent Network is doing to help educate, other leaders and things like that. So, well,
Thank you so much, and everybody have a great weekend, and we'll see you next week for our next Friday feature.
thank you.